there are people that are finding themselves depressed, they're being anxious, they're facing a lot of uncertainty, and there's a lot of fear. We're all struggling and dealing with our own issues, and this is the time that it's triggering our anxieties. The Dr. Amen recently posted this. It said 45% of Americans have been impacted with this anxiety, and it's bringing up mental health issues for people. So it's during these uncertain times that we have to prioritize our mental health and get treatment if needed. Otherwise, if you ignore your symptoms, they'll only get worse. Hi, I'm Dr. Nafisa Sekandari, a licensed clinical psychologist specializing in anxiety-based disorders. I created the Mental Health Break podcast to give you simple, actionable, step-by-step strategies to help you prioritize your mental health. Mental illness can cost you time and money. Ignoring your symptoms will only make the problems worse. Taking time out of your busy day to dedicate to improving your mental health can lead to long-term health and wellness. In this podcast, each week you'll learn tips, tricks, and proven strategies to help you regain control of your life, all while prioritizing your mental health. If you want to improve your life, regain control of your mental health, and feel empowered, you're in the right place. Let's get started. Today's episode is brought to you by the Transforming Anxiety course, an online, self-paced anxiety course to help you manage and control your anxiety from the comfort, privacy, and convenience of your own home. Learn how to transform your anxiety in just 6 short weeks. Course registration is now open. To learn more, visit transforminganxiety.com/course. Today, I'll be talking about the different types of therapists and the types of therapies available, mental health challenges within the Latin American, African American, and the Muslim communities, and just trying to really give you a structure and foundation about mental health in case you are looking for getting help. This week, I also received my copy of Psychology Today magazine, and in that article, in that magazine, there was an article that really spoke to me. There was an article about life quakes. Life quakes being events or transitions in your life that really turn your life upside down and impact your life in a way that kind of shakes you. And so today being one of those, so many things are happening, but these life quakes happen every 3 to 5 days, every 3 to 5 years in your life. And so it happens to all of us. It's not a linear thing. It's not like a midlife crisis that people go through. It's something that every 3 to 5 years, something will happen that'll shake you up, that makes you rethink your life, reevaluate your life. And so, but it's disrupting enough that forces you to maybe change course, change direction. And it's interesting, as I was reading that this week, it made me think about my own life. And mine, it seems like it's happened every decade. I've had a life quake. And just thinking about it all, like my first decade, my first 10 years of my life was all about, well, not all about it, but it ended on war and migration. So when I was 9 years old, I'm from Afghanistan, so the Russians invaded Afghanistan and we had to leave our country and sneak out and end up in a different country. And so that was me ending my first decade, dealing with immigration, dealing with war, dealing with displacement. And then my second decade was all about culture shock. I was adjusting to a new home, to a new country, learning a new language, learning to have a different life, a new normal, and missing, leaving my past behind. So it's like every chapter has had like a cap ending with it. And then my third decade ended with social anxiety and hormonal imbalance and moving every 3 years and college and all of that upheaval. So every year I've had basically, every 10 years there's been some major life quake that's happened, but that's basically life. Deaths will happen, sickness will happen, accidents will happen, crises will happen. That's just what life is all about. One thing that I did over the first 3 decades of my life anyway, I felt like life was just happening to me and I was just being reactive. I was constantly in a reactive state and not really feeling like I had any control or say in my life. But in my 30s, I decided to take back control and became more of a co-creator in my life. I stopped being reactive and focused on being more proactive. And that's around the time when I started prioritizing my mental health and focused on feeling more empowered. And that's, or also I was in graduate school in my 30s, so I was forced to go to therapy. My program required us to do 50 hours of therapy. So I don't think I would have gone to therapy given the stigma in my culture. But even though I was studying to be a clinical psychologist, which is so ironic, but because I was forced to go, it really opened my eyes to the feeling empowered and working on being more proactive in my life. So that's around the time when I became obsessed, I guess, with being prioritizing with my prioritizing my mental health and focusing on being more in control and not being so reactive in my life. And so I've noticed that the more prepared I am, the more stable I feel, and the less shaken up I feel when these life quakes happen. Like I said, these life quakes are going to happen whether we're prepared for them or not, but it's really to our advantage for us to be prepared. And so just like, remember, we had those earthquake drills at school, and we would do them. We'd go hide under the table so that we can be prepared in case an earthquake happened. Well, I think preparing for a life quake kind of does the same thing for us. It helps us to be prepared so that we're not taken off, we're not caught off guard and shaken to the core at the point of being paralyzed and not being able to do anything. So I feel it's really important for us to constantly be prepared and focus on being mentally stable, focus on being mentally healthy, so that when these life events happen, we're better able to prepare for it. So this quote also spoke to me. It says, "It's not what happens to you, but how you react to it that matters." And that's so true. Life is always, things are always going to happen, but it's a matter of how are we going to react to it? How are we going to process all that information? And here's another picture that really spoke to me as well. These things have just been coming to me lately. So yeah, life can happen. It's just, you can have this perfect life and then it could shatter and fall apart, and you can just pick up the pieces and turn it into something beautiful. Um, I don't think any of us are going to get out of this life with a perfect life. And just even being with my aunt the last couple of days and watching her gasp for her last breath, and um, made me really think about my own life. How do I want it ended? How do I want, what contributions do I want to make in the world? I do believe that life is all about our eulogy and not about our resumes. And so death is a wonderful thing, that it makes you focus on being present and really making the most of this world and not letting time slip by without really feeling like we've done something and just wasting it. I do believe that we need to prioritize our mental health. There is an epidemic right now. Mental illness is becoming a major issue in the world. It's a global epidemic, and so we need to do something to take back that control. There's a lot of uncertainty in the world, but there's always been uncertainty. There's always been fear of the future. But for some reason, given our lifestyles, we're suffering more, with anxiety being the number one disorder in the world, depression being on the rise. People are having difficulty sleeping. So it's so important for us to reset our system and go back to prioritizing our mental health. So for that reason, I've been putting out a ton of information since the beginning of this year, created an online, like I said before, an online comprehensive self-study course for people that want to work on transforming anxiety, but they don't have access to mental health professionals, or they don't want to work with a therapist. So that course is also available. In this course, I outline step-by-step instructions on the effective strategies and tools for transforming your anxiety at the root. The course is actually set up as if you're in therapy with me for 6 weeks, but it includes so much more information than I can even give my own patients over a course of 6 weeks. I've been just wanting to put out information so people can have the information that they need to prioritize their mental health. The pandemic has forced all of us to be confronted with our mental health and mental illness. Some people are just, their anxiety is being triggered, their trauma is being triggered, their fear of death and dying is being triggered. And I know, although I've been blessed enough to continue to see my patients, most of them virtually, there are a lot of people around the country and around the world that don't have access to mental health professionals. And so I'm doing this for them as well, so that they can have some support, some inspiration, some motivation to get to take back control of their lives and feel more motivated and inspired. So I wanted to start with talking about the different types of mental health professionals. If in the United States, I don't know how it is around the world, maybe you guys can share with me what it's like to look for mental health professionals and what kind of licenses and degrees they have behind their name. But if you've ever looked for anybody in the United States, you see so many different types of degrees and acronyms and titles. And so it's really confusing to figure out, what does it all mean? Who are these people? I'm even confused sometimes. Sometimes I'm like, what does this mean? What does this mean regarding their training? What kind of therapist are they? So I wanted to take that time today and make it simplify everything for you so that you understand, who are these therapists? What kind of therapy do they have? What kind of training do they have? What's their background? And then we'll go into the types of therapies available for you so that you can make a decision about what is best for you. Is CBT better for you? Do you need EMDR? So all of those acronyms, I'll go ahead and simplify for you today. And then we'll end with how to make the most of the therapy session that you are, once you are in therapy. I have so many people that come to therapy unprepared and they miss out on taking advantage of the session. So if you go in there with an agenda and want to work on things, then you'll definitely make the most of therapy. So we'll talk about that in a little bit. So like I said, there are all kinds of mental health professionals, and there's a lot of different, this is just in the United States. I am sure there's a lot of other people out there. In other countries, they might have different acronyms and different names. And then also the kind of training needed in the United States, mental health professionals, they need to their training depends on the specific field as well as the states that they participate in. So we have to be licensed in order to practice and provide therapy. Psychologists often require a PhD, while psychiatrists require medical degrees. And in every state, they are all required to have college degrees with specific training. And I'll start with a psychologist here. They specialize in the science of behavior, emotions, and thoughts. We can be found in various settings like hospitals, schools, private practice. We treat a range of issues from relationship problems to severe mental illness through counseling. And like I said, we either have a PsyD or a PhD. Although psychologists don't usually provide medication, they don't prescribe medication, there are some states that are giving psychologists in the United States, at least, prescription privileges, meaning that they can prescribe their patients medications related to mental illness. So the next group we'll talk about is psychiatrists. Psychiatrists are either medical doctors or they're osteopathic doctors. So you'll see DO after their name, or you'll see MD. They mainly diagnose, treat, and help prevent mental illness, emotional and behavior disorders. They use psychiatric medications, physical exams, and lab tests in their treatment of mental illness, and they can also provide psychological assessment. And then psychoanalysts they follow Dr. Sigmund Freud's theories, and they help people explore their repressed or unconscious impulses, anxieties, and internal conflicts. This is done through free association, dream interpretation, analysis of resistance, and transference. Some people really like the psychodynamic treatment of mental illness because they feel like it helps them explore their deep psychological and emotional disturbances that create bad behavior patterns without them even being aware of it. But be careful when you're selecting a psychoanalyst, because the title and credential is not protected by federal or state law, which means that anybody can call themselves a psychoanalyst and advertise their services. The next one is marriage and family therapists. These marriage and family therapists specialize in common problems that can come up in families and married couples, from differences in personality to marital conflict. The next one is psychiatric nurse. They're registered nurses who specialize in mental health. They perform psychological therapy and administer psychiatric medication. They typically operate under the supervision of a medical doctor. And then we have mental health counselors, provides counseling. Their title also can be, they can have licensed mental health counselor or professional mental health counselor. It's important to ask about the counselor's education, experience, and types of services involved, since this term is really vague. But they can specialize in job stress, addiction, marriage, families, and general stress. Okay, psychotherapist is a general term, again, includes psychologists and therapists. It's just some people like to say they're psychotherapists instead of specific to psychologist or marriage and family therapists, but there are many different types of psychotherapies. And then we have social workers, who are a group of public employees dedicated to helping people cope with and solve their issues in their lives. They work in clinical settings, like we have licensed clinical social workers. They can work in clinical settings and provide individual therapy. Social workers can also help with personal problems and disabilities. They may address social problems like substance abuse, housing, and unemployment. And there are many types of subtypes of social work. They can include family, child, and school. There's medical, public health social workers, and of course, mental health and substance abuse. And then we have addiction counselors. They treat people with addictions. This involves substance use or gambling, but also can be less common addictions such as sexual addictions and hoarding. Addiction counseling is often done in group settings. And then we have religious counselors, known as pastoral counselors. They're trained to help people with a variety of problems. Their primary focus is on crisis of faith, marriage and family counseling, and emotional and mental health problems. This is usually done within a spiritual context, and these people are usually leaders in their church, a temple, or mosque. They may have extensive religious and mental health training. So we also have here art and play therapists. They do a very specific type of therapy. This involves using creativity and for like painting, board games, sand trays, writing to explore and help with depression, medical illness, and past traumatic events. And addiction. People really like this type of therapy because they think it can help you express underlying thoughts and feelings that traditional talking therapy might not be able to get to. So we talked about all that, but who do you choose when you have so many choices? How do you know what kind of therapist to pick? But I do want to really emphasize that it's really important to pick the right person when you're looking for a therapist, because the right person can help you get through that whatever struggle you're going through. It's important that you have a good connection with that person. Therapy is very different than going to a medical doctor. A medical doctor, you might go to one person and then you can go to another person. It's not a big deal. But with therapy, it takes time to feel comfortable. It takes time to feel safe enough to be able to talk about some of the hard, difficult emotions that you're dealing with and processing. So make sure you pick the right therapist for you. And if that person is not the right match, find another therapist. It's not a big deal. Our feelings will not get hurt. I know I'm not the perfect therapist for everybody, and none of us feel like we're the perfect match. It's important for you to feel comfortable with that therapist. It's not something we're going to take personal. So if one person doesn't work out, find another person, but don't give up on the idea of therapy. Of course, their specialty and training matters, and it's really important, but you also have to make sure that you feel comfortable, because that connection is important, but also the location. It's important for them to be available locally. It's important for you to look back for their specialty, their training, their methods, whether they're available. I know people that are going to therapists once a month or once every couple of months, and that's not really going to help you. You need somebody that you can see consistently initially, so that you can create a routine and then eventually go to once a month. But there are people that are so booked, they can only see people every once in a while. So availability is really important. And cost is really, really important. Therapy can get expensive really quickly because you are seeing somebody weekly or biweekly or monthly. And so make sure that your insurance is covering it, or that you're able to cover the cost before you sign up with anybody. And then convenience, making sure, like I said, they're close, they're local, and that you can go see them regularly. I know because there's such a shortage of therapists as far as Muslim therapists in Arizona, a lot of people have to come from far away to see me, and I discourage them, because unless they're able to commit to someone on a regular basis, therapy is going to become a burden. And so I encourage people to find somebody that's local and someone that they can see regularly when they need to see them, so that they're not feeling overwhelmed with having to do that long drive. If you have to go far away, you're not going to want to keep your appointments. You might end up canceling more regularly. And so find somebody that's local. With therapy, you can't help someone that doesn't want help, right? If they see no problem, you're not going to be able to shove it in their face and say, you have a problem, you need to get help, because they might be in denial, or they might have an issue with not being able to accept the fact that they do have anxiety or depression, or maybe just dealing with stigma. They can't admit that. I think just being supportive, and then also protecting yourself, because if they're having a difficult time and they're taking out their anxiety or their anger or they're depressed, you need to not take that personally. I'm a believer that if you don't feel that you have a problem, or that you're not struggling with anxiety or depression, nobody's going to be able to force you to get help. So I hope I'm wrong in that, but that's been my experience in therapy. Now, let me talk briefly about the different types of therapy, therapeutic methods, and then we'll finish with how to make the most of your therapy sessions. There are many, many different types of therapeutic methods in addition to all the different types of therapists and different approaches work for different people and for different conditions. If your therapist offers an approach that you're not familiar with, make sure to ask a lot of questions about its benefits. So we'll start with the oldest, which is the psychodynamic approach that's based on Sigmund Freud's teaching and focuses on the past, family relationships, symbolic experiences to help you deal with current problems. And then the next one is dialectical behavior therapy, or DBT. This was originally designed to help people with borderline personality disorder so that they can live normal and healthy lives. But it's also showing promise in helping people manage their emotions and coping with distress, even when they don't have any underlying mental health issues. So what this approach does is it blends individual and group therapy with life skills training, mindfulness-based approaches, and an intensive focus on helping you better identify, understand, and regulate your emotions, reactions, and behaviors. So a lot of people are beginning to use this for more than just dealing with borderline personality disorder, and it's showing some promise in helping them, people with various stressors. Cognitive behavior therapy is something that a lot of you probably have heard. It's CBT is what people normally refer to it. But this works on the premise that our thoughts affect our behavior and our behaviors affect our lives. An example would be a woman who's afraid of being abandoned in a relationship might become really, really clingy that her partner ends up ending the relationship. So then she ends up validating that fear of abandonment. But what CBT does, it helps people work on controlling your feelings of fear so that you can go on and having healthy relationships or making healthy decisions in your life. Through CBT, you can learn to identify unhealthy and misleading thoughts and then replace them with healthier and more accurate ideas. CBT therapists often assign homework or worksheets. So CBT works best when you're willing to do the extensive work on your own between sessions and outside of therapy. This next therapy approach is eye movement desensitization and reprocessing, which is often commonly known as EMDR. EMDR was originally designed to help people cope with the after effects of trauma. Some therapists use it to help you manage difficult emotions such as anxiety and phobias, or to establish clear coping skills for an event you find frightening. EMDR also works by using using a specific set of eye movements or pulse sensations in your hand as you talk to your therapist. These eye movements or pulse sensations help your brain process information slightly differently, making it possible for you to reintegrate traumatic memories so that you're not controlled by fear. You can also work on past irrational beliefs such as phobias and jealousy using EMDR. I personally love EMDR and find that it works really well with traumatic experiences that you don't want to rehash during talk therapy, or trauma that's so difficult to process on your own. I know somebody had posted a question last week about how to deal with difficult trauma. If you have significant trauma, if you're struggling with difficult to deal with, manage a significant trauma in your life, I wouldn't recommend you dealing with it on your own. Talk to a trained mental health professional and get help, because that trauma is not going to process on its own if you don't know what you're doing. You could actually make it worse. So find a way to work with somebody that can help you deal with that. And look for mental health professionals who are not only trained in EMDR, but also specialize in trauma as well when you're looking to use EMDR for managing trauma. The next one is emotionally focused therapy. This was first developed in the 1980s as a type of couples therapy that focused on developing strong attachments. Some therapists now use it with people who are experiencing relationship difficulties, but who don't or they can't attend therapy with their partners. And then the next one is rational psychotherapy. It's built on the principle that relationships are central to human existence. And when your relationships improve, your quality of life does as well. This approach uses your relationships with your therapist as a springboard for dialogue. It's also a good way to learn new skills and then master the art of relationships. So there are many other types of therapeutic models out there. I just wanted to highlight a few of them, just so that you can have an idea of what the common ones are out there, so that when you're searching for a therapist, you're a little more familiar with what the language is and how they're using to describe themselves and what that will mean for you and the type of therapy that you need. If one of these methods don't work for you, try another. Keep trying until you find a match, like I said, with not just the therapist, but also with the approach, so that you find somebody that actually works best for what you need and helping you manage your situation. So now that you know a little bit about the types of therapies out there, let's talk about how to make the most of therapy sessions. It's really, really important, like I said, to choose carefully, evaluate the different therapists, not just for their credentials, but on how comfortable you feel talking to each of them, and then pick one and dive in. You don't have to be too shy about it, but just try one. If you're not sure about your new therapist, I would say just give them at least 3 sessions to see if they're a good match. Unless, of course, initially it's a really bad match to begin with, and then you can just say no, thank you, and go find somebody else. View therapy as a collaboration. Make sure that you understand that this is an interactive process. This means that you need to express your needs, ask questions, read books, do the homework assignments. This may also involve telling your therapist what you'd like to discuss during a session, asking for clarification about something you don't understand. Maybe they want to tell you to do something about homework and you're like, I don't feel like doing that, or being honest about it and saying, I'm not a journaler, I'm not into doing that work. But being open and communicating, giving them feedback, and being engaged in your therapeutic session. And then the third one is schedule a session that works for you and the therapist. This means that schedule your appointments not only at a convenient time, but also when you can give your full attention. Turn off your distractions and get a babysitter if you need to. And also show up consistently and don't cancel frequently, just so that you don't disrupt your treatment. Because when you constantly cancel, you're not getting the benefit of that therapeutic session. You're not focused on fully getting engaged. It's like going to the gym. If you hire a trainer and you barely show up for your training, you're not going to see the results at the gym. So you need to be that consistent with therapy as well. Don't censor yourself. Say anything in therapy. Some people feel that they're going to be judged, or they might be impolite for saying certain things, but I recommend you say whatever you need to, because that'll lead to your progress. Mention seemingly unrelated things, because you never know. You might mention something and then the therapist might pick up on that, and that could be the clue that they need to help you go forward. Talk about any concerns you have about therapy. Talk about the assignments. Talk about the comments made by your therapist, and don't hold any of this in. Sometimes I might say something without even thinking about it, and it might rub my patient the wrong way. I would rather they tell me than take that and hold that grudge against me without even bringing that up with me, because this is, like I said, a collaborative effort, and I'd rather know how we can move past it and work on issues that are coming up. And just remember that being a good client doesn't mean you have to be on your best behavior. It means being authentic, being honest, and being unfiltered. Set clear goals with your therapist. Help them. This kind of setting these goals will help you track your progress and stay motivated. Journaling will help you keep your progress. So write down the changes you're making weekly. Write down the results that you're seeing. Write down if you're seeing any progress, so that you can keep track of that. It's really important to do the work between sessions. Keep a journal. Reflect on all the sessions. Once you leave the office, think about the sessions. Write about it. Think about what came up. This will also help you go to the next session and have that information, and guide and structure that session so that you can keep moving forward. And then pay attention to your thoughts and feelings throughout the week. Don't give up. Process your feelings when things get hard. That's when people normally drop out of therapy, but process those feelings when things get hard. Communicate your struggles with your therapist. Commit to making an effort. Take responsibility and be consistent. And like I said, most importantly, just be honest. So participate, commit, be responsible, be consistent, and be honest. If you haven't already, you can show support for the Mental Health Break podcast by subscribing wherever you're tuning in from today. And while you're at it, feel free to give us a review or a 5-star rating, since that'll help others find the podcast. We have some great interviews lined up, and you don't want to miss a single episode. Subscribe today so you get notified when new episodes drop. I can't wait to see you here next week. Same time, same place. Bye for now.